Last March 2021, the Institute for Climate and Sustainable Cities, together with the Women in Earth Initiative, visited Guiuan, Eastern Samar to conduct a 2-week training to capacitate local development planners in pursuing gender-responsive and climate strategies at the local level. The municipality of Guiuan, Eastern Samar was the site of the first landfall of Super Typhoon Yolanda last November 8, 2013. In 2017, they formed the Guiuan Recovery and Sustainable Development Group for Resilience, a multi-stakeholder collaboration platform that builds local resilience across sectors, focusing on the intersection of climate change, disaster risk reduction, and ecosystems management.
So Guiuan has been doing their climate change adaptation framework since 2018. And it's already up for enhancement, for review, and of course for revision. And with the World Initiative project, our aim is to ensure that gender issues, health issues are integrated in their whole climate change adaptation framework so that they will be able to use this not only for their local climate change action plan, but also for their gender and development plan to see a more inclusive or more integrated development policies at the local level.
According to the United Nations Commission on the Status of Women, climate change is not a gender-neutral phenomenon, and that climate change raises certain gender-specific impacts. These direct and indirect impacts cause gender-related disparities in human security, socio-economic population, as well as on health, including sexual reproductive health and rights.
Health is a human right, so it's a right for all. So I think if considering health in the aspect of climate change in gender, dapat inclusive kasi niya. So di niya specific lang group, it should be inclusive. So dapat tanan should be considered when we are planning for health. And accessibility and affordability, dapat aada ito niya. Then sometimes we equate also health itong climate change, ini-equate to natin itong poverty. Kaya kung kulang ang kaagi and family affected and health and effective ng climate change na mas na i-intensify with climate change, na intensify in poverty, so na eventually na-affect ng health.
Knowing the dynamics and interlinkages of gender, health, including sexual reproductive health and rights-related issues at the communities, while experiencing the impacts of climate change, the adaptation strategies planned and implemented at the local community level would vary and should be responsive to the interlinked issues, hence should not be one size fit all.
So for the first workshop, we came up with a set of photos, a gallery, and asked for their perception and relate it to their experiences as planners at the local level, what they see when they do conduct field work and also conduct site visits in areas in Guiuan. For the second week, it's more closer to reality, as we say, using the photo voice methodology. It's a researcher, the photo takers, takes a photo in the ground based on several research questions. For this workshop, we tried to focus on the issues that were raised during the first workshop based on their perception, and also ensuring that the initial insights from their climate risk and vulnerability assessment are taken into consideration. So we went to 2 sites in Guiuan, Barangay Campuyong, which is a coastal community, and also a small island, Barangay Trinidad in Tobago Island. We tried to look into the issues that were raised for the past 2 workshops and try to take the photos there.
Parang yung lalamanin ng ating plano ay grounded siya, in a sense na yun nga, bumaba tayo, nag-gather ng stories. So napakahalaga nun dahil nakita natin yung iba't ibang papel na ginagampanan ng bawat sektor, no, sa komunidad, kababaihan, kalalakihan, kabataan. So nakita natin yung specific role and at the same time yung impact yung climate change itself.
The workshop teaches the participants to validate their work. It's crucial that they see with their own eyes the reality from the stories they gathered from the field visits. This helps them decide on the means or the adaptation initiatives that they can include in their policies and plans that will encompass all genders. One of their observations is the vital role of women.
Siguro yung role ng kababaihan na manggagaling mismo muna sa kanila. Within them, they should have the knowledge what is happening around, what is happening in our environment. And kung walang steps na gagawin sa ngayon pa lang, this might affect to the future generation. So sa ngayon pa lang, dapat itong mga kababaihan in the community would have the exact knowledge on how to combat this climate change. With that understanding, magkakaroon sila ng mga idea kung paano ito ma-actualize doon sa mga communities nila.
Pag meron tayong eksakto na kaalaman sa situation ng mga kababaihan, makakapag-formulate tayo ng mga policies or directives or mga laws na angkop doon sa kailangan ng mga kababaihan. Kasi pag hindi tayo back up ng data, hindi natin ma-i-influence o hindi natin makukonvince yung mga decision makers. Tatanungin nila tayo, saan ba kinuha to? Ano bang basehan niya to? Dagdag pa yung mga photo as evidence. Makakatulong yun talaga sa pag-convince ng mga decision makers natin o policy makers.
After 3 weeks, what we've accomplished is the first step in collating all the necessary information or data using the climate risk and vulnerability assessment. There should be a balance between community assessment and of course the science-based assessment to ensure that it's really evidence-based assessment. So with that, once we are able to gather all the data, the information, we'll move on to the planning stage itself.
This August 2021, the ICSC team returned to Guiuan to oversee the planning process. Together with SICAT, another civil society organization partner of Guiuan, ICSC was able to present a recommendation to the LGU on how to integrate gender and health strategies in climate action plans.
Malaking tulong talaga ang integrated analysis tool or yung sa CRA and RCA po na integrated tool siya kasi mas nakikita natin yung connection sa gender, sa health, at sa climate. Bali, mas makikita po dito yung bigger picture kung saan mas makakatulong ito para mas ma-improve pa po natin yung mga implementation ng ating mga plans sa local or sa ating local communities.
The good thing with ICSC is they presented to us a long list of menu of what to do because this is the way to go. We do hope that this will be part of the discussion with the local development council, even our engineering department and other departments that this be included. Kaya kung tutusin, nakalista na nga daan, we're giving, this makes our job easier if we only could apply this and in fact follow these recommendations. Kaya instructive naman talaga ini, And the imminence on climate change and global warming is andin na talaga. We're fortunate that NGOs like ICSC and even WORT is part of the, they made Guiuan one of their pilot projects in expanding the research, rather the reach and scope of our CCAPs.
The municipality of Guiuan recognized the important role of gender and health in enhancing their climate change adaptation framework. These workshops and planning methodologies will help identify the important role of the community in influencing their LGU to create evidence-based solutions. These plans will serve as a shared ownership and responsibility between the government and the community. There's more work to do, but this is a promising step towards gender-responsive climate resiliency.